let's get started because I don't want to hold people up. I appreciate you very much being on the call. It was a short notice, but we're happy to have you with us. As I said, I'm Larry Boris, the Executive Director, NAWHC, and this is a call to providing an update and steps moving forward for our Fair Market Value Collaborative. And what I'd like to do is, for those who have not been familiar with it, or just to keep you up to speed, just go through a couple of updates to bring you where we're at today. So the Fair Market Value Collaborative was an effort began about I think 2 years ago now. Our focus was to revise and amend the IRS code that required an individual with a health savings account to pay a mandatory copay when receiving medical services from an on-site clinic that go beyond first aid and triage, and that cost has to be equal to the fair market value of those services. I put in quotes on-site clinic because the rule defines it in a way that, frankly, was done, I believe, under COBRA. So it only viewed on-site clinics at that time as really first aid stations providing just acute care services. So our effort was, because of the change in the marketplace and the evolution of worksite centers, to change the definition of on-site clinic to reflect the broad scope of services that are now available in today's on-site and near-site centers, and to create a list of core primary care, condition management, and other services that could be offered at an on-site or near-site center that would not require fair market value payment to those with HSAs. So what we've done to date is ERIC, which is the ERISA Industry Committee, which is a Washington-based group representing the largest employers in the country, has led our effort in focusing on the strategy, coordination of calls, collection of data, drafting legislative language, and setting up and conducting meetings with policymakers in Congress. Over 20 employers, vendors, providers, consultants have participated in these meetings with a core set of providing funding, including NAWHC, to help support ERIC's activities. Thus far, we had created some legislative language and, in fact, submitted a bill called the Employee Access to Health Services Act, which was submitted in the House. And we had a number of sponsors there. It was not submitted in the Senate as things were developing. We had a variety of meetings with legislators and their staffs to identify sponsors, both on both sides, because we wanted this to be a bipartisan effort. And language ultimately was not adopted by as a bill itself, but was incorporated into a bill that did pass the Ways and Means Committee, called the Bipartisan HSA Improvement Act. So the challenges we've got in moving ahead is that we've had a pushback from those who don't like HSAs. And so we're really focusing less on HSA improvement and more on improving access to care and lowering medical costs for workers and their families, especially those in rural and medical shortage areas. So a number of meetings are being planned with policymakers with this new focus. To support these arguments, we really need data on the number of employers, the centers, lives covered in certain states where these policymakers are influential and are committees that can make a difference, particularly in California, Colorado, Delaware, Ohio, Virginia, and Washington. And so I'm going to turn the discussion over to Christina Strojas, who's lead on our group, to talk about some upcoming meetings and, again, the data that we have or perhaps we need. So, Christina, I'll turn it over to you.
Yeah, it's perfect. Thanks, Larry. So just more so highlight again what Larry has said. The House has passed the legislation in a larger HSA package right now. It's still in flux for being considered, like, moving more so forward with the Senate in larger HSA telehealth legislation package that is, like, trying to make its way towards the end of the year. So what we need to do as a coalition is to have our Senate version of the bill introduced. We've locked in our Senate Republican, Senator Tim Scott of South Carolina, and then also have a Democrat lined up, but doesn't necessarily want to take the lead just because they are off committee. And that is Senator Peter Welch of Vermont. So again, our focus is really going to be on Senate Finance Democrat members, especially those that are down dais What I would like to, and Larry provided in the previous slide, the states that I think are really key in gathering, and making sure we have the clinic. Not necessarily clinic numbers are important, but more so again the number of lives that are being served, because we're trying to refocus our talking points, and it's more so about addressing patient access than anything else. And that seems to have a better that is being better received compared to kind of the talking of the eight talking HSA dollars. So highlighting the more so the access to, and especially in what areas as well, is really important when we do meet with certain offices. And I'm gonna drop in the chat for everyone just to see, you guys can see the list of the Senate Finance Democrats on the left, and key offices that I believe are that I really would like to have be the first to second meetings would be Senator Maria Cantwell. Her staff did express interest, but at the time they were working on this big PBM legislation in the Senate Commerce Committee, and she chairs that committee. So because of her work there, she didn't have the capacity. So now that PBM transparent, that legislation is kind of like put to bed. It's a great opportunity to go back to the office and re-engage with them. So having worksite health centers that have a presence in the state would be wonderful to attend this meeting, and I'll be setting up meetings in the next 2 to 3 weeks so that we're able to, and these are all virtual, by the way. You do not need to fly into Washington, D.C. to have these meetings. So all of these will be virtual, but again, Senator Cantwell is really our primary target. For those of you that haven't been with us before, we were close in getting Catherine Cortez Masto to introduce. However, there was some pushback from unions on the legislation that caused her not to be the lead. So again, Cantwell was going to be our focus. I think Delaware as well. I know Larry connected us with a large company in Delaware that is based there, that is looking into more. I don't believe they're a fair market value collaborative member, but they're looking more so into the legislation and may potentially be able to join us in a meeting with the office, as they have very close relationships, as Senator Carper is also on the Agriculture Committee, which is important to this member, this company. So do you guys have any questions for me? I know I kind of rambled, but in giving a lot of information of like the prime target, and Carper as well. So the prime targets, but I'll be setting up a few other meetings as well based upon the information that you guys provide to me in regards to the worksite health centers.
Well, let me ask you, Katrina, are you attempting to resubmit then the employee health access bill as a freestanding legislation in the Senate then?
Yes, we need to introduce the legislation in the Senate in order for it to move ahead in the legislative process.
So we're not looking to tie our language to another bill then at this point?
So it passed in the House, and so in order for it to be considered in a larger package, we need support on the Senate side. So having the bill introduced on the Senate side will give it more consideration into it being included into a larger package. So even though our work is done on the House side, we still have work to do on the Senate side to make sure that if it comes down to negotiations, that this is included too.
Okay, but when you say pass, are you talking about the Bipartisan Improvement Act, or are you talking about the bill we submitted, the Employee Health Access to Worksite Services?
So, I'm talking, so when I say the legislation was passed in the larger HSA package, um, that's what I mean by our legislation was
Okay,
passed.
gotcha,
But
gotcha,
it's important to clarify that the language that we introduced back in the 117th Congress that we worked on, that is enhanced language, that would be what we would like to introduce on the Senate side. So,
gotcha.
with that, yes. So, and that language is also of interest to to Senator Peter Welch. So which is wonderful. I don't believe Senator Tim Scott's office is actually comfortable with it as well. So, it's just more so again finding that Democrat that wants to be a lead on an HSA bill is more so the what we need to accomplish.
Okay, all right. Well, I'm going to go around the table and see if people have any comments or questions about this. So I'll start with Tim Miller, Med Partners. Tim, any comments or questions you have?
I don't really have any at this time. Thank you.
Sure. Will Wright, comments, questions?
Sure. So even though I'm trying to get what the messaging is going to be, Christina, and those that are going to participate in meetings, we may do a secondary follow-up call. But when we say we're focused on access, is it that PPO members have unmitigated access because they don't have to pay the fair market value, but high deductible plan participants are restricted, and so we want to remove that barrier, and it just so happens to be HSA adjunct, or how's the messaging going to be packaged?
Yeah, and I was hoping that we would able to.
Do you want me to jump in here? It's Melissa.
Go ahead, Melissa.
I think, and Christina, we'll work for sure on the messaging before the meetings. Thanks, Will. But I think what Larry at the start of the hour was speaking to was the fact that there is significant pushback by Democrats in doing anything that is seen to bolster high deductible health plan HSAs in general.
Right.
So if you're looking at expanding uptake of these, plans, that's not a good thing for them. And so explaining the issue in the context of currently there's such need for better access to primary care services, and through a lack of, in many ways, a lack of accessible primary care providers in many areas of the country, that the worksite clinic model really does fill in where there is this very real need to ensure workers are getting access to basic sort of primary care, chronic care treatments, what they would see in a physician's office offsite, right? And so really doing a messaging shift around, hey, if you do these things in the context of bolstering the ability to use your HSA, how do you HSA dollars better? It's more like, hey, these clinics are an incredibly important primary care provider for many communities in this country. And, if you are able to make just certain regulatory flexibilities in place, even more people could really use their limited dollars in healthcare go further in how they use these clinics on site, right? So that's the kind of messaging, I think, nuance that we're trying to achieve here, if that makes sense.
Yep.
Okay.
So when we talk about data, we're talking about like how many providers are employed and running through your clinics, how many patients are you seeing, what kind of primary care service are you providing, and how much of it? What would be the nearest hospital or the nearest urgent care center in some of the more rural areas if they weren't able to just go to the on-site clinic and get their services done? Those kind of things really bolster the need to prop up and strengthen the use of worksite on-site clinic care generally.
Thank you. Andrea, your comments or questions?
I think I'm good, actually. Thank you.
Okay, Deanna, any comments or questions?
No, not right now. Thank you.
Okay, Kate Begley, any comments or questions? Katie, any comments or questions? Okay, Kendall Rosemeyer, any comments or questions?
I do not, thank you.
Okay, Kendall? Okay. All right, so Christina, then what's the next steps? What are the meetings coming up that you need some help with?
Yeah, so the talking points, we're happy to send well, I think Larry more so has an idea, more so the coalition members that are active and also a part of the coalition. So we'll send in Larry, I'll send you some questions, the ones that Melissa listed, so that can help members in kind of gathering the data as well as formulate some talking points. Obviously, each person is going to tailor that to their own organization. So that will be the first item on our list. And then I will start sending out the meeting requests so that we can possibly start meeting next week and the week of the 10th.
Okay. And so the week of the 10th is when you plan to have meetings?
Yes, and I was going to see the week of the 3rd, might be next week, so that might be a little probably more so towards the end of the week, but probably the week of the 10th will likely be the best for everyone. So it'll give enough time for people, the week of the 10th, so that we'll give enough time for the people to gather their data and kind of refine their talking points next week.
Okay. So I would ask anybody on the call, in addition to Will, that has populations or centers in those states, to contact myself or Christina directly, and we'll get so we can have your data. Even if you can't be in the meeting, it'd be helpful to have data on your activities in any of those states, particularly those that are going to be meeting most recently. Anything else? Any other questions or requests, Christina or Melissa? Yeah.
Thanks for getting it back together.
All right.
Push it forward.
All right. Thanks very much. We'll keep you informed. And please do respond to data requests. It is just so key in these discussions because you can go and have the greatest argument, but if they say, well, what's going on in my state? And we don't have any information, it just falls on deaf ears and they move on to the next topic. So it really is important. Well, thank you all for taking time today. Thank you, Christina and Melissa and everybody else on the call. We look forward to talking to you in the near future. Thanks again. Bye-bye, everyone. Have a good weekend.